right, let's go ahead and get started. Good afternoon, everyone. My name is Megan. I'm the co-founder and COO of Mika Health. The title of the talk today is One AI Clinic Assistant, Every Task Handled. And I want to share with you a little bit about Mika AI and what we see as the new era of AI for clinics. As a reminder, today's webinar is going to be recorded. I have Julian here with me from the team. He's going to moderate the Q&A for us. He'll let me know if anyone has questions. Please do feel free to drop your questions and comments into the Q&A. I'd love to answer them. And the kind of run of show for today's presentation, I have a few slides that I'm going to share. Some of what we think is around the corner when it comes to AI for today's clinic. And then we'll end off with a Q&A, and that's where I can jump into live demos of any of the things that I talk about today. So with all of that, let's jump in. As I mentioned, my name is Megan, co-founder and COO of Mika. My background is product design. I've spent more than a decade now designing and delivering healthcare technology to teams across Canada. And that's what I love to do. Back when I was in school, I was on like a pre-med kind of route in university. And then I realized that I was totally squeamish and would not be a good doctor. But I love design. And so I love building tools that doctors and their teams can use to take care of patients. Today, I wanted to set the stage by really kind of touching on, or starting with what it's like to operate a clinic. And when you think about it, there's a lot of different people involved. There's a lot of different workflows, jobs to be done in order to deliver patient care. Lots of things that need to happen before, during, or after an appointment. And so, if you think about your team, you probably have MOAs. They're there answering the phones, answering patient questions, scheduling, reminding, prepping patients, collecting information, making sure it gets into the EMR. We have nurses on our teams. They're delivering care. They're triaging patients at the beginning of the appointment, kind of prepping the chart, prepping things for the physician. And then in that appointment, the physician is, really delivering that core care service, hearing the patient's concerns, assessing, sorting out what needs to happen next. And then on that note, there's often folks on the team who are taking care of those follow-up and referral steps. After that, there's admin to be done, billing coordinators to bill for services, and then clinic managers and other admin staff that are, making sure that the lights are on, that all these people are coordinated and scheduled. And so there's a lot of work to be done in order to operate a clinic today. And I work with hundreds of clinics across Canada, and what I really see is that most clinics today, they're not facing a people problem. People go into healthcare because they want to take care of patients, deliver an outstanding experience. But what I see clinics suffering from time and time again is that the people at clinics have a workload problem. So when we first started Mika, we would talk to doctors, talk to staff at clinics, nurses, MOAs. We would sit in waiting rooms. We'd sit behind the desk and just kind of try to get a picture of what's going on and get a sense of this workload problem. And what we saw, and probably in your own day-to-day, a lot of that time that these people are spending, the people who work at clinics, it really isn't direct patient care. There's a lot of administrative workload that gets in the way. And not only is this problematic for patients, it's problematic for doctors and staff, for their burnout, their stress. And when it comes to the clinic's bottom line, that patient care time is really that revenue generating time. So it can be quite costly, this workload problem. And that at Mika is what we are really focused on solving. How can we take this pie chart and turn more of that gray administrative workload time into patient care time? Some stats. This is from 2025, Canadian Medical Association, just kind of further adding to that picture that 64% of physicians report spending a significant amount of time in their EMR doing administrative tasks outside of their regular hours, up to 10 hours, over 10 hours per week on these kinds of tasks. And this is probably no not surprising to anyone, many physicians, 46% of physicians reporting high levels of burnout. And these are just some statistics for physicians. We know that burnout is a huge problem for the other folks on that team as well. And what's been really interesting and exciting to be a part of in the last 18 months or so is that I think clinics are really starting to see the potential of AI in addition to other automation tools to really turn that around and make a difference. And I think the big story here, the one that's kind of makes the headlines, is AI scribes. This is a result from a study that Ontario MD did. We were part of this project. And you can see there in the middle that, scribes really can have a significant impact on administrative tasks, especially related to charting, and some of that after hours time. What's amazing about the introduction of AI scribes is that I think it's really starting to change how a lot of clinics operate, starting with providers. But at the same time, most clinics are really only seeing a small piece of what's possible with AI scribes, and that's what we'll touch on here today. So when it comes to changing that pie chart, getting more of that gray administrative workload time transformed into patient care time, there's a couple of different options or tools, solutions out there, approaches to automating some of these administrative tasks. And, the one I would call traditional automation software, this is software that automates with logic-based processing. Sometimes this is called rules-based. What's great or about this and kind of how it works is that the same inputs always result in the same outputs when we're working with traditional automation. So it's really functioning like you can think of it like a calculator. So 2 + 2 always equals 4. It's a deterministic system, and it can really alleviate workloads or help automate workflows that are trigger-based. So like when a particular kind of event happens and we need a workflow triggered off of that, it works really well for schedule-based workflows. So we need something to happen at the same time, kind of before or after, or at the same time every day. And it's also great for highly standardized workflow. So where you're really looking to achieve a very standardized and consistent kind of result with your workflow, as well as routing. And so a great example of where traditional automation can play a key role in alleviating administrative burden for clinics is things like appointment reminders. So there's a schedule-based kind of workflow. You want a reminder sent out maybe 7 days before an appointment, and you want all of your patients, or at least all of the patients with a certain kind of appointment, to get the same kind of message. You want them to get the same kind of tasks potentially, and you want that to be very consistent and very reliable. And so traditional automation is amazing for that kind of workflow. What has been made possible with the new generative AI technology that's emerged in the past couple of years or so is this opportunity for inference-based processing. And this is sometimes called probabilistic processing. What's different here is that even if you have the same inputs into a generative AI-based system, you can get different outputs. And so instead of a calculator, I like to think of this kind of like a very fancy Plinko machine. So you can put the ball in at the top in the same place, but it might not end up in the same place at the bottom every time. And so this type of automation is amazing in these kind of emergent, nuanced, kind of fuzzy situations. It can summarize, it can create content. And so the shining example, AI scribes are based on this kind of automation, and they're amazing at taking this really nuanced, unique conversation that the provider is having with the patient, summarizing that, creating content based on that. So if we kind of look at both of these kinds of automation tools, when we think about traditional automation, some of the key advantages here is that this type of automation, it's incredibly reliable and consistent. You can explain it so you can understand why a patient got a certain message or didn't get a certain message. And that makes it quite safe. And as I mentioned, also enables that standardized experience, if that's something that you're looking to provide or that's helpful in the situation or the workflow that you're trying to automate. Some of the disadvantages of traditional automation is that it can't handle those emergent and nuanced workflows, like summarizing a unique patient-provider conversation. And it can be very difficult to configure and maintain some of these traditional automation systems. It can be very tedious to set up the various workflows, and some of the systems, they can't even handle a great deal of complexity. It's just too much for the rules-based system to handle. On the flip side, generative AI really complements traditional AI. Some of the advantages here is that ability to handle those emergent and nuanced situations. And oftentimes when we're dealing with generative AI, you can have a very natural kind of conversational interaction with it. So different than like the traditional software experience. However, in terms of disadvantages, it is not fully reliable. It's not explainable in terms of like why the AI did something. It's very hard to trace how that came to be. And it can be very difficult to achieve a high level of standardization. And so you can think of this, certainly for the context of appointment reminders or appointment booking where you want a lot of standardization. But even if you're using an AI scribe, you may see this in some of your notes and documents that you're generating from time to time with the scribe. It's not going to be perfectly standardized. And these systems can also be difficult to create kind of complex multi-step workflows with. Because it's kind of like this newer technology and maintaining information from step to step. So as you can kind of sense where this is going is that for clinics today, you really do need a combination of both traditional automation to handle some of the workflows and tasks, as well as generative and AI-based automations, more emergent and fuzzy situations. However, a lot of the options that you see out there today in the marketplace are really focused on traditional or generative. And so when we here at Mika think about what the new era of AI is for clinics and what we're developing Mika AI to be, it's really to bring together the best of both traditional and generative and be a true assistant for everyone on the team. So not only the providers, not only the MOAs, but for everybody on the team, and really start to see some interesting benefits and advantages with Mika AI. So when we think about a patient journey and what this new era can look like, there's, as we talked about at the very beginning, a lot of steps and a lot of people, a lot of jobs to be done to get a patient who needs care into an appointment and followed up with and on to their next step. So from booking to reminding to collecting information and forms, checking them in, having that appointment with the nurses and the physicians, the charting and the documentation that needs to happen after that visit, follow-up tasks such as referrals, and then on to the next step for the patient. And so what we're really excited about with what we're building with Mika AI is the ability for Mika AI to really support each step of this journey. So not just a single solution, not just one kind of automation, but really bring together those different types of automation to support and power entire patient journeys at your clinic. So let's take a look at a scenario. What could this look like? Let's imagine Sarah. She's a 29-year-old woman. It's 8:14 p.m. at night, and she has just found out that she's pregnant. So what could her journey look like? Sarah can go onto her clinic's website right away. So you can see it's 8:17 p.m. She's on there, and she can interact with Mika as a chatbot to give Mika some information about why she's coming in, and then Mika can route her to the right kind of appointment type and then help her actually book that appointment right into the EMR after hours in a few minutes. So Sarah's going to get the care that she needs at a time that's convenient for her, and she doesn't need to call the clinic, create an inbound phone call for staff to handle, or wait on hold. Next, Mika can remind Sarah about her appointment with an appointment reminder. So you see a text message appointment reminder. Sarah can confirm her appointment, and then she can complete a task with Mika, which in this case could be a prenatal intake. So again, with that easy to use chatbot experience, Mika can collect highly relevant information. We can deliver prep instructions to Sarah. And so here we're able to ensure that Sarah shows up for her appointment. She's prepared for her appointment, and we've already collected relevant information and even pushed that into the clinic's EMR. Again, all without phone calls that staff are trying to make that patients don't pick up. We can get that all done ahead of time. And then if we think about the appointment itself, Mika can actually pull all that information that was collected from Sarah ahead of time and put that into a brief for the physician. So this is where we can see some of the interesting kind of synergies between the workflow automation tools that impact MOA and kind of front office workflows, and the automations that impact providers and the in-appointment workflows. So we're seeing a bit of a handoff here. We're actually taking that information, summarizing it, and displaying it to the physician within the appointment. So now the physician's prepared, they can focus on Sarah during the appointment, they turn on Mika, Mika listens to that conversation, and then Mika can generate notes, customizable in terms of tone and style, templates. And in addition to notes, Mika can also draft referral letters, which you're seeing on the screen here, as well as imaging and lab work requisitions and filling other kinds of PDF forms. And so with this kind of tool, we can eliminate up to 90% of the documentation burden that providers face. Again, that's not just notes. We're talking about some of the downstream documentation, like referral letters, PDF forms, and even billing claims. The other thing we can do, and this is that next handoff, handing off back to the follow-up and the next steps, is Mika can draft a summary of the conversation, the appointment, in patient-friendly language. Mika can pull together the to-dos for the patient and make it super easy for the physician to send that to Sarah in a secure message. And so you can see here, we've got a summary, we've attached a prenatal questionnaire, some resources. The physician can decide if they want to enable Sarah to reply to this message and then send that off, so that before Sarah even gets to the parking lot off of her appointment, from her appointment, she has everything she needs to take those next steps in her journey. And again, this is another moment where with this all-in-one assistant, we're able to link the provider workflow automation in terms of creating those notes and documents with some of the follow-up automation. So in terms of providing resources, next steps, helping patients navigate. So when we look at the impact of an all-in-one clinic assistant, you know, from all the different workflows that we can transform, we can take booking, we can make it more convenient for patients, reduce the inbound phone call volume for staff. We can send reminders to reduce no-shows and reduce outbound phone call volume for staff. We can perform intake and collect relevant information, provide patients with prep. They can do this ahead of time. We can eliminate a lot of that paperwork, a lot of that data entry that MOAs need to do. We can help physicians with their charting. We can prep them with a brief. We can create their chart notes as well as a bunch of other documents and forms, including referrals. And then finally, linking back to the patient and giving them what they need to take next steps and get the care that they need. So there's benefits here for everybody that's involved. Again, thinking back to the beginning and all of the people who are involved in making care happen, from MOAs to clinic managers and physicians, and of course, patients as well. So I think one of the key takeaways here and what I want to leave you with, and really what, again, we see as this next era of AI for clinics, is that while there's a lot of individual solutions out there, of them focus more on traditional automation. Some of them focus more on generative impacts. They can save hours of time. They can really streamline different workflows within the clinics. What we at Mika see is the future of AI for clinics, and then bringing in this new era with Mika AI is really creating this all-in-one solution that can truly transform care and the way that your clinic operates day to day by linking those workflows together and using the best of both worlds when it comes to traditional and generative AI-based automation. So that's all I have for my slides. Thank you so much for your time and attention. Would love to open it up to comments, question and answer, and of course, happy to do a live demo of anything that I was sharing with you here today. Awesome. Okay. Awesome, Henny. Great question. So the question here is, Mika can help with booking. Mika's not an EMR, but how does the booking request look like in the different EMRs? Okay. There's a couple of different options. So we try to make it very flexible to fit kind of your clinic's needs and the different needs of different appointments, and you can mix and match these. So in one case, Mika can automatically book the patient into your EMR schedule. And again, you can choose the criteria there. So maybe they have to be a previously registered patient. Maybe it's certain appointment types that they're allowed to auto book for. But in that case, the patient chats with Mika, and then that appointment, they're going to see appointment times from your EMR schedule. Mika's going to pull that availability. And then when they select a date and time, Mika is actually going to put that appointment into your EMR schedule. So that would show up in your EMR schedule, just like as if your MOA or your nurse or yourself booked it. On the other hand, you can make it possible to make it a request that your team needs to review and approve. So in that case, the patient's going to select a date and time or a few dates and times that work for them. That's going to show up as a request in the Mika AI work list. So your staff would be notified about that there's a request for them to review. And they can just click to approve it, and then it shows up in your EMR schedule. And that's based on what the provider makes available. Yeah, so totally. So we pull the availability from your EMR. So there's lots of different ways to set up schedule availability. It kind of depends on your EMR and how you use it at your clinic. And so when our team helps you set up that booking feature, they're going to work with you to kind of have your templates available and then match it to the Mika's booking chat, if that makes sense. And I see you have your hand up. So I'll just let you to hold on, raise your hand here and talk if you'd like to. Okay. Yeah. Go for it, Henny. You're live.
Hi, Megan. Can you hear me?
I can, yeah.
A great presentation. Thank you so much.
Thank you.
I'm really curious about this whole overhaul for Mika, and
Yeah.
I'm really comparing to what the clinics here have in terms of the EMRs that they're using
Yeah.
and the appointment reminders or notification systems integrated, which is usually some sort of like a third-party integration with
Yeah.
EMRs. So if we're talking here that like if they're gonna remain using the same EMRs, whether like again we're not really making any ads for any company anyway. Would Mika AI
Mhm.
replace the other, I guess, alternative options in terms of patient self-booking online while keeping, I guess, the authority in the hands of the clinic, as well as sending appointment reminders for patients for the booked appointments? And how does that look like?
Yeah. So Mika AI, you're correct. We don't replace the EMR. We integrate with it.
Yeah,
We can replace other add-on EMR add-ons that you may already be using for booking and reminders and messaging.
right.
And by doing that, it can kind of simplifies things to have it all in one, but you also get those links between like what I was showing with collecting the information before the appointment and then feeding it into the scribe, taking what was talked about in the appointment and putting it into the patient message. You can get some of those links.
So the only difference here is when I'm comparing again to those third-party integrated
Mm-hmm.
services and Mika being one of them now,
Mm-hmm.
the difference is once you launch that service from within the EMR, it opens up that kind of like patient profile on that other
Mm.
platform, which
Yep.
means that it somewhat saves some of the patient information. But the Mika here says that it's not saving any patient information. So I'm not sure how, if a provider
Mm.
launches Mika from within
Yep.
EMR, what are they seeing?
Yeah. So let me just
I mean,
go.
I've played around with it a little bit just to
Yeah.
be able to give providers some presentations on it. But
Yeah.
for that specific online booking, like the AI, like the new integrated services that AI is going to introduce with Mika for the booking or the reminders, I'm wondering how much of information would it have if it's not storing any data?
Yeah. So if you are using Scribe only, then it depends on what the data retention settings are, of course. And so if you're using all of the features, then we would, through our integration, we would sync appointment information and some basic patient information, such as their contact information, like a cell phone number, email address, to be
Yeah.
able to contact them with. Um, Whereas with the scribe, we would still be following your data retention policies. So, for example, deleting the transcripts and the notes from the encounters, like within 7 days of the encounter.
Okay.
So, upgrading or adding the other features that I'm talking about, it does sync appointment and patient information from your EMR, and it would keep that information for longer than, say, the 7 days that it's keeping the transcripts and notes from the scribe, if that helps answer that
Okay.
piece. How this
Yeah.
can,
Sorry, go ahead.
yeah, sorry, how this can look like is I'll just kind of show you this. So these are our appointment journeys, and this is where we're setting up the triggers for the different journeys. So for example, prenatal. So say the appointment reason here is prenatal from my EMR, then this patient is going to get a booking notification. They're going to get a 7-day appointment reminder with a prenatal chat. They're going to get a 2-day reminder with a patient chat there, so on and so forth. And as you can see, I can create these different journeys with different notifications and different tasks associated with them, based on these different combinations of
So
reasons.
each one of those lines represent a workflow for a specific situation,
Yeah, yeah, you got it. Yeah.
and those reminders are usually in the format of an email.
So we usually do, it can be an email. We prioritize sending an SMS if we have a cell phone number, and then an email, and then an automated voice call, kind of in that
Okay.
order. But yeah, yeah.
So I know that probably all Mika users now, like within the first 12 months, which is covered
Mm-hmm.
for a license, they would probably have access to all of those features. And I'm wondering, what does it look like after the 12 months period? And I'll tell you
Mm-hmm.
why I'm asking this question. But like, is it like going to be different tiers of services or features that the provider can select from, or is it just one package?
So it's different features that providers can select from. And here, let me just see if I can show this. This is kind of what we have right now. We do have, let's say, some promotional packages for folks that are transitioning off of InfoWay funding, who might have come to Mika AI
Yeah.
as like Scribe first.
Mhm.
So how we've set it up today, although I want to caveat this with like, we will always work with a clinic to get a package that can work for you.
Yeah.
But basically the way it works today is that, you can still start with Scribe, and then we have it broken up into different kinds of skills. So for example, the booking piece, reminders and notifications, forms to
Mhm.
collect information. You can kind of mix and match and build your own assistant. And so our goal here is to enable people to start with just one skill, one workflow, but also create a more comprehensive package. And as I mentioned, you know, we're always working with clinics on an individual basis to get them to the package that works for them.
Yeah, so the situation I'm speaking about here is a bit bigger than just one provider or one clinic. Like we're
Yeah.
most of our providers here have obtained their 12 months license through the Nova Scotia Health pilot program with you guys.
Mm-hmm.
And
Mm-hmm. Yeah.
it's interesting to study what Mika is now offering, like in terms of new services, compared to the
Yeah.
currently third-party contracted services, like outside EMR for the notification
Yeah.
services, the booking services.
Yeah, for sure. Yeah. Awesome. But yeah, I'm excited to see for Nova Scotia specifically, I'm meeting with some of those folks next week and
Oh, is that right?
showcasing some of this
Okay.
as well to them. Yeah. So honestly, if I could follow up with you, Hani,
I
afterwards
would
and
be
just get more of
happy
your
if you
feedback
can. I don't know how
to
private
bring to
this.
that, that would
I
be
don't know how
great.
private that presentation is, but if you can plug me in, I'll be happy to attend that. If not, I'll be happy to follow up after.
Awesome. Awesome.
In
Cool.
the
Well, thank you
meantime,
so
is there
much.
any
Thanks for all
like
the
videos or resources that we can view these new features on?
Great question. We will be coming out with a bunch of videos that will focus on each of the different skills. So as soon as those are ready, we'll be announcing that. And we'll also have a recording of this webinar.
Mhm.
So we'll have that as an overview, and then we'll have more detailed materials coming out in the coming weeks here.
Perfect. Thank you so much, Megan.
Awesome. Yeah, thank you. Okay, great. So I just want to say thanks again to everyone for tuning in today and letting me share a bit about what we are working on here at Makata, what we see as the future of AI for clinics across Canada. We will be following up with an email. It will include a link to the recording for this session. It'll also include a link to book a conversation with someone from our team. So if you're interested in diving deeper into anything that I touched on today, we'd love to have a conversation about your particular clinic and what that can look like for you. So yeah, please enjoy the recording. Please get in touch. And again, thank you so much for being here and taking some time out of your day to spend with us. Awesome. Have a great rest of the day, and thank you, everyone.